And today I am pleased to have with me Dr. Michael Miller, Chief of Infectious Disease at Phelps Memorial Hospital, and also visiting professor in medicine and infectious disease at Einstein Medical College. And today we're going to discuss the flu, influenza, the injections, and immunizations. What's fact, what's fiction? This is certainly information you can use.
What we know is genetically is that the genetic makeup of this current influenza is similar to something we saw in pigs in the 1990s, okay? But it also contains avian bird flu components, and it also contains human components. So we don't have exact proof, except indirect proof, that this came from pigs. We know that there was a very similar influenza in pigs in the 1990s, not the same virus.
Now, fairly recently, there was a great deal of concern about an avian virus. Now, this was an avian flu. Is this also an influenza?
Yes.
And this also is seemed to be transmitted from birds to people, but not so easily.
It was a true pandemic. It occurred all over the world. There was only a handful of cases, and those cases were people who had very close contact with birds, or in one instance, I think it was in Vietnam, very close contact with one another. Right. Because of these projections that you were talking about before, that we create antibodies to, these projections actually permit the virus to stick to our nasopharynx. Right. The ones in birds very poorly stick to our nasopharynx. So that's probably one of the reasons that we did not see a lot of this very deadly bird flu.
Now, again, that's the big concern about all these new viruses, especially given the history from 1918, is that they can cause huge, population deaths.
Right.
And we haven't seen it this time, at least not yet. As we record this, we're in mid-December. Yeah. And there's different peaks and recurrence of the disease.
It appears to be nothing like the 1918 epidemic. Now, when we had the Asian flu, which was another pandemic, and the Hong Kong flu, we saw maybe not our 33. This is in the United States, 33,000. deaths, but maybe 70,000 deaths. But we've never seen 500,000 deaths in the United States as we saw in 1918.
So you said this is the fourth largest cause of death in the United States.
The pneumonia is the fourth leading cause of death in the United States, and most of that pneumonia is bacterial pneumonia in older people seen in nursing home patients who initially have influenza. In fact, the way that the state health departments and the federal government recognize up until now an outbreak of influenza was looking at deaths in old people in nursing homes. Once that began to rise, then they would look for influenza.
Speak to your family doctor. The information's out there. There is something we can do. There is no reason for fear, certainly at this stage. Thanks again for watching. See you next time. Bye-bye.